So what do you do going back to those old crowns that we used to get? Because I have 2 of those in my mouth now with more recession becoming longer in the tooth because of age. And you said, genetics might have a little bit to do with it as well in my case. But so I'm starting to see on these back crowns that metal that you talked about on the inside of the old crowns.
Right.
And it looks bad. So what can somebody like myself do about that? Can you replace an old crown with a new one? And what is the process for that?
I mean, an old crown can be separated easily, replaced. You can do a veneer on the crown if that's all you don't like. Everything else is nice.
Oh, you can? You can put a veneer on a crown.
Yeah, of course.
How does that work?
Yeah. It might not have the same strength as a veneer on enamel.
Okay.
But if you need to, if the factors of taking that crown off, for example, sometimes someone has an implant on a front tooth that has like an unusual implant type. That's a complicated connection. It's way below the gum line. It would be easier than replacing that implant, just putting a veneer over the porcelain. So you can bond to porcelain or zirconia if you need to.
And that's just a really thin layer that you bond on top of the tooth.
Yeah, you would need to use air abrasion, and you would need to prepare the surface.
Yes.
As best you can. But then it would be better to just put a veneer on the porcelain than to replace the whole implant.
For sure, and more cost effective.
Definitely.
Too, right?
Yeah.
How long do veneers last?
Those factors are multiple, different, but I like to say 15 years, 15 to 20. Composite veneers or direct veneers. Porcelain veneers are kind of like stone or tile or glass. Those are going to keep their color longer. And so they're going to last
different
a little
grades
bit longer.
And then different price points for different grades. Is that how it works?
Yeah, I mean, people replace their veneers for a few reasons. Usually it's that gum line reason because their gums are slowly receding. So they're going to replace their veneers if their gums are showing the old color, basically, right?
Yeah, right. Yeah, I get it.
Because all we can do is slow down aging, right? So
as
we can't
best
reverse
we
it.
can.
Yeah, right. So if we can slow it down, that's wonderful. Like that's what we're going for, right?
Right, that's what we're going for.
Yeah. But people replace veneers usually because of the natural aging process. It's not always because of chips and fractures, although that can happen. But usually it's because of uncovering the margin, the edge.
Okay.
And then people want to change the color. And usually people aren't as bold enough at the beginning. I wouldn't go super bright white without translucency.
Right.
So there's 2 factors in the color. There's the shade, how white is it? Also the translucency, how does it transmit light? So if it's too translucent, if it's too far on the translucency, it starts to kind of look a little bit gray.
That's how my other teeth were. Plus they had that gray underneath or that color underneath, so they... Yeah,
translucent teeth kind of appear gray over time. As we go to opacity, teeth that are too opaque, now you're talking about teeth that kind of look fake. Bright
too
white.
Yeah.
Yeah, and some people want other people to know that they've got, veneers.
Oh.
Right?
Really?
I mean, if you want that Hollywood schnazzy,
Hollywood,
like I can afford these teeth kind of thing, like jewelry.
I've seen those.
But I would say that most of my patients want to try to pull it off.
As natural, like these are my teeth.
Exactly.
That's how I feel, yeah.
Like they want to keep people guessing. Okay? They're like, ooh, those are nice, natural.
Yes, right. You were fortunate as a kid to have a great dentist and orthodontist, look like, wow.
Yeah.
Lucky
so that's usually what we're going for.
Yeah.
And sometimes, they want that. They don't know it. Maybe they've had old crowns that are too white. They just want they're not used to the translucency until they see it. You know?
What about a tooth? Like I have one of the teeth in my mouth that you pointed out that's going to need a crown at some point in the near future. I don't like the shape of this tooth right now in my mouth. So when I get this replaced, is there a way, like it seems smaller than the rest and it has like a weird angle to it. Is there a way for you to make it look better when you replace it with a crown?
Yeah, I'm really excited about artificial intelligence in dentistry, right? So the AI now in the crown design process is astonishing.
Really? Yes?
Yeah,
Tell me more.
It's pretty cool. So if we were to replace a crown, the catalog of teeth, the intelligence in the software is going to analyze all the wear patterns of your other teeth, anything in the field of view.
Wow.
Also, it's going to go into like certain catalogs of teeth, and within 15 to 20 seconds, it'll come up with a design that's pretty close. That design can be changed, and lately what I've been doing is I've been making changes, that I think are better.
Yes.
And then after seating the crown, adjusting the adjustments that I do based on the bite or whatever, guess what? I'm adjusting what I changed. Does that make sense? So like I'm realizing now that I'm the limiting factor. That I need to just leave it alone or make very few changes, big changes. Make very few big changes. Like I'll adjust the contact area for like floss that's really smooth and tight. Like people have that satisfying like click when they floss. They snap the floss.
Yes, right.
So
yes.
So I've got my own preferences with that, and so I don't want to take people away from what they're used to. But as far as like the AI that goes now into the crown design or the veneer design, it's pretty good, and it's going to get better. But it's already really impressive. So there's going to be factors. We're probably not going to try to take your new crown very far from your old one.
Yeah.
But there might be some design changes. Usually what I'm seeing is old crowns that people have are too big. That's usually like more often
they
they're too
are
big.
Big. Yeah. Yeah. I think because of the way they were built with the different layers of things.
The old way, it requires thickness.
Yeah. I mean, I can feel it. Like if I put my fingers inside my mouth and feel those old crowns, they're much wider than the crowns right next to them that you created.
Exactly.
Yeah.
So usually, the correct size is smaller than that old crowns, a little bit smaller,
and that
a noticeable effect.
And that might have something also to do with, I mean, I can just imagine a tooth in your mouth that's bigger than it's meant to be.
Yep.
Can affect a lot of things negatively.
Right. Yeah, you bet. I mean, for one thing, it traps, like food between the teeth, right?
Drives
if it's too
me
big.
crazy.
Right. Yeah.
Drives me crazy. I can't eat a spinach salad in public, and I have to go to the bathroom, spit out the water, and, until all the stuff quits falling out of my mouth. And then I'm safe. I'd look, maybe floss a little bit. But you're right. That's where it traps. That's why I need to get those crowns redone. That's one of the reasons why.
The contour,
it can't be good for the gums.
The contour of your crowns or your teeth is extremely important. Extremely important. And so, this is something that there's a big difference in talent when it comes to labs that aren't as careful about that contour and the way the crown's designed too. As the tooth's shaped, and it emerges from the gum tissue, it has to follow a certain contour.
Yeah.
Or there are some side effects to bad contour, like
a
flossing.
shelf.
Yeah, like a shelf.
Like it creates a shelf where everything sits on top of it.
Yeah,